clinical case of doing that exact thing, where this guy was a high schooler. He needed to get his pictures done for senior pictures, and he wasn't done with his Invisalign yet, but he wanted to get these old restorations off. So we're like, okay, we're not going to do the fancy layering yet because he still needed to whiten his teeth at some point. So we're like, let's just use the Omnichroma and see what happens. So we take off the old restorations, we do our bevel, we do our air abrasion. Here is our first layer of Omnichroma. And then here's the blocker as the dentin. And in this case, he doesn't really have much or any incisal translucency, so we don't need to worry about creating that very much. And then here's the final Omnichroma layer over the top. And then after shaping and polishing, here's an immediate result. He was traveling from out of state, so I didn't get any follow-up pictures after the teeth had rehydrated, but not too shabby, right? I mean, that's pretty acceptable results with a single shade composite. So that simplifies all this fancy layering that you need to do with the polychromatic technique, which is harder to master because you're trying to deal with all the different layers to get them just right. So if you're looking for something simple, this is pretty awesome right here. Now, here's one where I'm using the layering technique that I would use for the polychromatic, but with the Omnichroma. And this is the hard one because the teeth are darker and the teeth are super thin. This is an older person and there's a lot of stuff going on there, right? These are the hardest ones. And a lot of dentists might be afraid to put composite on a tooth like this because they're like, well, it's just going to break off in a couple weeks. But if you apply these principles of layering, then they actually stay on pretty dang well. The air abrasion is probably one of the best strengthening features of doing these things, but getting your bevel done as well. So here it is, very small bevel. I got rid of some of the sharp jaggedy edges across the incisal edge as well. Composite doesn't like sharp pointy things. And so we soften those up. You can see I air braided up quite a ways. Here's the first layer of Omnichroma in place. And like overall, the whole thickness of this incisal edge is super thin. It's only like a couple millimeters, maybe 3 millimeters thick total, super thin. So here we are with the shelf without the backdrop in place. Here's the blocker acting as the dentin, and her other teeth did have just a little bit of translucency across the tip. Now in this case, because it was such a thin tooth, you can still kind of see that hard fracture line, but I also don't want to build out the blocker thicker and wrap it up onto the facial more because then the overall restoration is going to be too thick. Or as I polish it back in the end, it's going to reveal that and you'll see the opacity of the dentin layered on too thick. So here's what we do. The next layer is where I add a thin layer of the Omnichroma to just kind of fill in where I put the blocker. But I'm leaving enough room to add some colored resins. And this is where I used kind of a taupe colored opaquer to highlight some of the mamelons, but also to block out the little hard fracture line a little bit more. She did have some darker colors on her too, so I had an ochre color, so we kind of warmed up some areas, and then she also had some little craze lines on her teeth, so we used the white and some of that. Sometimes I'll mix the white and the opaque color together 50-50 to just kind of tone down the intensity of the white. And then we put our final top coat of the Omnichroma over the top to seal those colors in. And after shaping and polishing, immediate results with all the dehydration. Looks pretty awesome. So that's kind of the way I use these single shade composites and get some pretty good results. There you go.